Good morning, everybody. Zach Long here, lead faculty for the Institute of Clinical Excellence's Fitness Athlete Division. And it's Friday, August 24th, Fitness Athlete Friday, which on the Institute of Clinical Excellence ICE Physio podcast means we're talking about what we need to do to keep fitness athletes active and help them out and provide them better care. So today we're going to be talking about strategies that we can use to keep our athletes active when they're injured, which is something that's really important to us in the fitness athlete division because we've got individuals that are coming to us after having put a long amount of time in trying to improve their fitness, whether that's recreational fitness or fitness to be competitive in their sport of choosing. And even when everything's done perfectly in training, in recovery, etc., injuries are something that are going to happen when we push our body and try to create higher levels of fitness. Little nicks and dings are going to happen for sure. And as medical providers, we need to do a much better job of encouraging our patients to stay active and helping them come up with strategies to stay active themselves. And far too often in the medical community, people are defaulted to the take a few weeks of rest. And within the fitness athlete division, we just don't believe that's the right thing to do. Not only because we want to help people continue to improve their fitness, but we also believe that if you take a certain period of time off, you're going to have certain weaknesses happen, things like that. So often in the clinic, I see when people take time off and they get back to working on their sport, that other little injuries pop up immediately after. So I think if we keep people training at as high a level as possible, that we are going to reduce their risk for injuries secondary to that. So let's dive into a couple strategies that I like to use with patients and principles I like to talk them through when it comes to trying to stay as active as possible when we're dealing with an injury. If you're an athlete dealing with an injury, please don't consider this medical advice. I'm just trying to give you some strategies that you can talk with your medical provider about. For a lot of these, I'm going to use myself as an example. I just actually had a pretty good pec strain a couple months ago when I was peaking my bench press to try to hit an all-time PR. And I was shooting some videos for my website, did some ring dips, went down, felt a pop in my pec. And at the time of that injury, I could not wash my hands without about a 6 out of 10 pain for the first few days. So it was pretty good. Well, definitely was not a complete tear, but I'm going to walk you through what I use and what I use with my athletes. So initially, when I was in that really, really hot phase, I did take a couple days off because, if I can't wash my hands without 6 out of 10 pain, there's not much force I'm going to be able to put through my pec. I couldn't do one push-up. But what I started with was using isometrics. So I would get down to the bench press. I would use a 45-pound bar. I would go down with the bar until I reached a point where I was at about 3 out of 10 pain, and I held that for about 45 seconds and did 5 45-second holds. That was the most force I could put through my pec at the time. And the deeper I went down, the more stretch was on the pec, major in the bottom of the bench press, and so the more uncomfortable that got. I stayed at a 3 out of 10, and I stayed at about a 3 out of 10 through all the variations we're going to talk about today, which is where I typically try to keep my patients at. I like Silbernagel, put out some great stuff on tendon loading, where basically we use a red light, yellow light, green light, which is what I typically use in the clinic, where I tell patients, if you have pain between a 0 and 3 out of 10, you feel a little discomfort, I'm okay with that. Don't worry about discomfort. If you're, 4 or 5 out of 10, that's probably okay. That's a yellow light, and we're going to reassess how you feel afterwards. So if we were to do bench press tonight and you have a little pec injury, how do you feel tomorrow morning? Are you more sore tomorrow morning as a result of what we did today? If so, we probably overloaded it a little bit, and we're going to be a little more cautious next time. Anything that's greater than a 5 out of 10, we're going to hold off on. So that's what I stuck to, what I typically use with patients. Obviously, you're going to have some patients that using this number scale just doesn't work very well. So I basically tell people, if the pain is intense enough that you feel like you are losing muscular strength or your movement patterns are being altered secondary to the pain, then that is too much. If you feel discomfort, we're okay. So I started with isometrics and eventually got to where I could do an isometric where I brought the bar all the way down to my chest. And so that was my initial progression in those first few days. From there, I did a number of different strategies to decrease the load. So at times that was going through and benching with full range of motion and just a lighter weight. So rather than, benching, close to 100% of my 1 rep max, I was down at 15 to 20% of my 1 rep max. And I was still doing kind of lower volume because if I pushed the volume too much with those low weights, then I would start to become more irritated in those tissues. But as I was able, I just started to consistently increase the load. And one strategy that I use with that, in that increasing load, is I also changed the range of motion I was training with. So I have this piece of equipment. They're called bench blocks. So bench blocks is something that I put onto my barbell, and it limits the range of motion that I can lift in. A lot of people might be familiar with board bench press, where you put a piece of wood or up to 3 or 4 pieces of wood on your chest, and you go down and touch it and limits your range of motion. Bench blocks just does that, but the board hangs on to the bar. And so what I would do during this period of rehab is, as I said earlier, the deeper I got into a pec stretch, the more painful I became. So I actually would lift through full range of motion and increase the load as I felt comfortable. Once I started to get above a 3 out of 10 pain with full range of motion, then I switched to partial range of motion and continued to add the weight up. So later on in my rehab, I could bench, 135 pounds through full range of motion. Anytime I got past 135, it started to become painful. And so I'd put the bench block on, limit my range of motion, get rid of that most stretched position, and I could load up to 185, 200 plus pounds and still stay really light in pain and actually get to loads that were getting fatiguing, which was really nice for myself. I was getting to train through full range of motion and do like some rehab training there. And then I was able to actually get to some hard, intense training that I know was actually going to help push my max strength up. So using that combination of decreasing load through limited range of motion can be really, really cool. I used a little bit of blood flow restriction training, and if those of you that are listening that are medical providers aren't familiar with blood flow restriction training, it's something that you should probably really look into soon. There's a huge amount of research on blood flow restriction training, in that we can use really light loads to create strength and hypertrophy changes. So if we look at what's typically said in the strength and conditioning world, typically loads of greater than 65% of an individual's 1 rep max are recommended if we're trying to do work on improving strength. With blood flow restriction training, it's been shown repeatedly in hundreds of studies that if we lift loads as low as 20% of an individual's 1 rep max, we can create significant strength and hypertrophy changes. So it's just a really powerful tool. If you're not familiar with that, check out Owens Recovery Science and the great research and work those guys are doing. Next strategy, using variable resistance. So we can use combinations of bands and chains to create changes in the loading that we put through on an athlete through range of motion. And this is something that's used quite often in the strength and conditioning world, not used too often in physical therapy from the thought process of accommodating resistance. But what I did here was I actually set, this is earlier in my rehab, I set resistance bands up to the pull-up bar that's above my bench press. So at the top of the range of motion, I was holding 100% of the weight that was on the bar. But as I went down, that band tension increased, and it actually deloaded the lower parts of the range of motion. So I was able to bench press, again, this is early on, so I was bench pressing 95 pounds on the bar. When I was down at my chest, there was actually very little weight on the bar, but as I locked up and got towards the end of my range of motion, I was getting to where there was 95 pounds on the bar. And that was a great way to unload the most painful part of the range of motion, but still have me taking my joints through full range of motion with a little bit of load on it. You can also do that the opposite way, where you have a band attached to something on the ground and then attached to your bar. So as you squat down, the band tension decreases. As you stand up, the band tension increases. So the resistance that you feel would be tighter at the top of the range of motion. That's something that's used all the time in strength and conditioning, but something that can be really valuable to those of us as rehab providers that are wanting to help individuals train. Another thing I used was some contralateral training. So research has shown several times that if we train the non-injured side, we can help maintain strength and muscle mass on the injured side. So I would do bench press with kettlebells, do dumbbell press, where I would use just my uninjured side, or I would have a really low tolerable weight on my injured side, and I would go as heavy as I could on the uninjured side. So using contralateral training can be really important, something that I encourage all of my post-op patients to do, because I think it can be really powerful for keeping them stronger as they rehab from that. Final thing we'll talk about is that we can really vary the grip, the stance, and the loading that we use to help individuals stay active. So these little minor variations can change the tissues that are stressed just enough to allow individuals to lift really heavy weights. For instance, for me, going overhead and doing a dumbbell overhead press, if I was in our standard grip versus a neutral grip, the standard grip with my elbows flared out wide was too much stretch on the pecs, and it was pretty painful, versus if I came narrow, it allowed me to get an overhead pressing motion in without overloading those pec muscles. So that was really good. Things like altering stance can be really important in helping people stay active. So going a little bit wider with your squat stance, a little bit more narrow, can change the loading that we have on certain tissues. And then we can also change just the loading itself. So take somebody with back pain. Sometimes they may not tolerate a conventional deadlift where the torso is typically a little bit more forward. And sometimes we can switch somebody to a sumo deadlift where the torso is a little bit more upright. And that little variation in the loading that's going on through the spine can help an individual tolerate that movement better than another. I've got a power lifter that I've used this with. So they were really tolerant of sumo deadlifts, not very tolerant of conventional, but he was a competitive power lifter. So he preferred conventional pulling in competition. He was stronger that way. So what we did to maximize his training was he did conventional deadlifts up until his back began to bother him. And then we switched to sumo, and he worked up as heavy as he could with sumos for that day. And that allowed him to continue to practice his competition lift with as much weight as he could tolerate, but then get to where he was loading his joints and muscles heavier by using the variation that his body tolerated better. We can see this a lot with the squat. So take somebody that has anterior hip impingement. Doing a front squat, the torso is typically held a little bit more upright, which means that the hip is typically taken into less hip flexion with the front squat than the back squat. So if an individual is dealing with some anterior hip impingement, using that front squat variation may be a way to alter the loading of the squat pattern just enough to allow that athlete to stay injured while they're training. One thing that's really important to discuss with athletes when they're doing any of these things is that they still really, really focus on technique and hitting proper positions. Something I'm doing right now on my Instagram, the Barbell Physio, is going through a series on analyzing bar paths. We talk about this a lot in the clinical management of the fitness athlete division in our fitness athlete courses, but you can look at an individual's bar path and how that bar moves when they lift it off the ground or when they push it off their chest, and you can tell a lot about their efficiency of their lifts based on their bar path. And so something that I'm going to stress to a lot of individuals when they're lifting these light weights is to really focus on making sure that they're hitting proper positions. They're trying to keep the bar moving exactly how we want to, so that they're, at the very least, they're getting a lot of training and practice hitting proper positions so that when we get back to heavier lifting, they are the most efficient that they can be in their technique. That's going to be really encouraging to them. It's going to really help them kind of buy in a little bit to, look, this stinks that you can't lift the weights that you want to lift, but we're at least going to have you in a better position when you get back to lifting heavier weights. We're going to make sure you're hitting everything the way we want to for maximal efficiency. Hope everybody got some good ideas out of that. It's going to either help with your own training or help with some athletes that you want. As always, we discuss a lot of this stuff in a lot more depth in the clinical management of the fitness athlete division. We spend an entire 2 weeks talking about modifying training while injured, so that when CrossFit athletes, powerlifters, Olympic lifters come to you, you are better prepared to keep them moving and better prepared to be the provider of choice for those individuals. So check those courses out at ptonice.com. Hope everybody has a great weekend. Thanks for tuning in.